One of my friends had come here before, and it's easier than making an appointment at a hospital because they ask you for insurance cards. I don't have insurance, but I work 40 hours a week. You know, I put in the system. But yeah, and I made a call, and they had me in here in a week.
The patient population that we serve has a very sort of interesting dynamic in that they're not eligible for government assistance, but they're not quite capable of financing, you know, getting private insurance or financing their own medical care. So being an intermediary between these patients and the medical world that they have trouble accessing, it becomes crucially important to their health, because in a way we are sort of their one-stop shop. We are the guys that they go to. So one of the largest goals of the project would be to improve access, and especially in a population that sort of has a more difficult time getting care than others.
So a typical patient visit, they come in, they schedule an appointment whenever we hold the clinics, and they fill out a vision screening questionnaire, which asks a series of questions asking, you know, when their last vision checkup was, do they wear glasses, are they having any problems that they've noticed with their vision. And then we do 4 different tests, and they're just initial screening tools that we use to see whether then they need to see an optometrist and whether we can refer them out. If they have very obvious problems that need immediate attention, then they, you know, we send them to DHMC to get immediate care or see an ophthalmologist.
I came today for a screening because I've had my glasses, these ones right here, since 1996, 17 years ago, original. I was finding it hard to see distance again, even with the glasses on. I didn't know about the screening for eyes until I called again. And then they called me back the next day saying that, would you like to come in for a screening? Oh, yes. Yes, very nice. Within a week. You can't get that with a regular doctor's office unless it's a real emergency. It's very much appreciated, this place.
The last interview I did with Wanda was very fun for me because she was such an outgoing person, and in medicine because it's such a efficiency-based, at least not in theory, but in actuality, an efficiency-based practice. You sort of get lost in the routine and the paperwork. And with patients like Wanda, who are very gregarious, very amiable, very nice, you get to sort of break away from that, okay, let me go through, I gotta do visual acuity, I gotta check visual fields, and it becomes more than just an examination, and it becomes a conversation.
The nice thing is we have a good chunk of time with each patient, so you really get to talk to them a lot.
I know I'm doing this vision screening clinic thing and I have to check off these boxes, but what I'm really doing is sitting down here with another person and having a conversation.
I think being able to have these experiences through Geisel it really complements, you know, the education and the learning that we do at Geisel. Geisel has a really great relationship with the Good Neighbor Health Clinic. There's a lot of programs that students run, or they just kind of volunteer on their own with the clinic. I know a lot of the faculty who are sponsoring this program are Geisel faculty members, and so just we feel really plugged in just with the opportunities and the support that we've gotten.